Every day, everybody asks me one question. Should I do this? Should I do this? What do you think about that? It all comes down to what's healthy and what's not. What's good? What's bad for our body? Well, we're going to see if we can't put that together for you in a little simpler plan here. We'll call it Health Simplified, a simple guide to a healthier life. And we'll start with a man who puts this guide together and practices every day in his practice, Dr. Justin Fessler. Welcome.
Thank you. How you doing, Paul?
I'm doing good today here. You know, I always feel better when this show comes around because I sometimes get burdened and think, oh,
you feel guilty too?
I do feel guilty. We've talked about it in shows here. You're saying, why don't you do this simple stuff here? And I go, oh my God. And that really is what today's show is about. With so many of us, we want an instant answer and we want a pill or procedure. Just fix it. My car's broken and you're like, well, how about if you just treated it better? How about if you, for our body, if you ate better, you slept better, you exercised? No, that's too hard. Just give me a pill. Mm-hmm. Just give me a new heart. That's much easier than.
I think that's changing a bit too.
I hope so.
I think because I'm hearing a lot of patients when they come in and they don't want that anymore. Yeah. A lot of them are trying to avoid pills. Some of them don't take Advil, don't take ibuprofen.
Yeah,
don't take.
True. I am.
Almost any pill.
They don't rush to go under the knife. We used to say, just go fix it, doc.
Yeah. So there is a wave of that. I think there's a lot more information out there. A lot of maybe some bad information, but a lot of good information too. And people are finding it and finding other ways of getting healthy that are more natural and trying to avoid
and maybe the
taking
body
too many pills
heal itself, or maybe we can avoid some of these issues before they become so difficult. I got to cut them out. Well, I'll tell you one that I don't think there is a lot of good information about.
Yeah.
Or a lot of misinformation. Mm-hmm. Sleep and pain.
Yeah.
We sleep because we're tired.
Right.
We sleep because it hurts. We sleep because we're depressed or whatever. But sleep
and
is
unfortunately, sleep gets put at the bottom rung of the ladder as far as importance.
Amen.
Which is awful. And I'd say I'm guilty of that over my lifetime, and I'm getting slightly better now. Mm-hmm. But when you're busy, you got kids, you got a job, you got your maybe business, you got all kinds, and you want to get your workout in, you want to do other good things for you, so and you want to still hang out with people. It's hard to get that.
So
sleep.
You got to sacrifice something, you say to yourself.
You do.
And what do I give up? Sleep's the easy. I have so many guys that come in here, mostly guys, big, powerful business types, and I say, I get up at 4 a.m.
Yeah.
I say, okay, when do you go to bed? Oh, I still go to bed at midnight or something here.
Not good. Yeah, that's not sustainable. Yeah. And it's really bad, and cognitively, everything else too. But it's also bad for what?
Apparently pain.
Pain, yeah. So
and that's why I say I don't think of sleep and pain. Sleep is the opposite of pain. I sleep to relieve myself of something, to relax, to relieve whatever, get rid of stress or whatever, just turn my brain off. But you're going to tell me today, sleep-pain connection here.
Yeah. So basically, as we look at sleep, we're gonna see how sleep affects us physiologically, and how that is going to affect a lot of the chemicals in our body that affect pain. So basically, the key concept that's according to the research that I've looked into is that there's a bidirectional relationship. Now, what does that mean? Mm-hmm. You got pain causing sleep issues, and then you have sleep issues causing more pain.
Vicious cycle.
Vicious cycle. Yep. It lowers, over time, the sleep lowers your pain threshold, increases your pain sensitivity.
Now say that again. So if I don't get enough sleep, I feel more pain and I feel it more intensely?
Correct. Yep. Even people that don't have chronic pain, if they were sleep deprived for a night or two, when they do these pain threshold tests on them, they are actually more sensitive to the pain.
Wow.
Yeah.
Because I'll say we do some other shows in here with people who deal with geriatrics and aging and other sorts of things. Chronic. I even do a guy who comes in here and talks about Eastern medicine and stuff here, acupuncture, acupressure. What do they all serve? Chronic pain. I think chronic pain is the chronic condition in the world today.
Oh, it's huge.
Oh, my back, my knee, my stomach, everything hurts all the time.
Yeah, millions of people have it.
Yeah.
It's an epidemiological issue. Yeah.
Right.
So and let's look at that too. There's large epidemiological studies that show that poor sleep quality and insufficient sleep duration are actually risk factors for developing chronic pain in the first place.
Wow.
Yeah.
Now, why? I'll stop you for
Yeah,
a
yeah.
second.
Mm-hmm.
So I go to my regular MD,
Mm-hmm.
and I say I got a pain.
Yep.
He never says, how well you sleeping?
Right. That's unfortunate. Yeah.
Never.
Yeah.
He says, where
It'd
does
be
it
such
hurt?
a simple thing for him, he's got the MD clout.
Right.
And he could be one that has a little bit more influence on someone to say, you know what, how much sleep are you getting? Or, are you using your phone right before bed? Or, there's probably 3 easy things that you could do to improve your sleep.
Right.
In about 3 or 4 minutes.
Turn your brain off, turn your phone off. My father used to write notes down so he wouldn't think about them all night long. He said, better to get up and write it down and then forget about it than to keep thinking about it.
No, that's smart. Yeah.
So whatever it is, make yourself sleep, because otherwise this is how you're getting this chronic pain. You want me to fix it? Let's fix your sleep.
Yeah, exactly. So some experimental research confirms this. And when healthy people are sleep deprived for even 1 or 2 nights, they develop increased sensitivity to painful stimulation and report more spontaneous pain-like muscle aches and headaches. Headaches are another thing that's kind of like a chronic pain issue as well.
Yes, exactly. Fits into muscle aches, back pains, stomach pains, all that.
Yep. So let's think about this. So if you have chronic pain and sleep poorly, each bad night makes tomorrow's pain worse, which then makes the next night's pain and sleep worse. And the cycle perpetuates and amplifies over time.
Wow.
So to kind of tackle chronic pain and get a hold on this, we need to definitely look at the sleep cycles and try to fix that problem.
So you're a physical therapist. You're a doctor of physical therapy. You've gone to big schools, USC or whatever here.
Yeah, I spent a lot of money on my education.
A lot of money to do this stuff.
Finally paid it off.
And when you're in these schools and they're showing you how to teach and how the muscles work and relax and stretch and bend, all these secret tricks that you teach us every episode here, do they ever say, hey, students, make sure you talk about sleep?
Yeah. It was not hammered in us.
Right.
Maybe there was a little bit, but no, it's not a main
Focus.
topic or course or, part of that. It's now something that I talk about with my patients, and educationally, I definitely talk to them a lot about it. But in schools, I don't recall it being something that we talked about at all. But I might not remember.
I hear the same thing about nutrition. I hear the same thing about sleep, and I hear often the same thing about exercise. The 3 things we have control over.
Yes. Yeah.
That we seem to think.
A great point.
Yeah.
Yep.
Okay. So how does sleep deficiency trigger
so
your
let's
body?
look at the biological mechanisms here. So there's a few ways that this deprivation can affect our body. Okay. So it can deactivate your body's natural pain fighting systems. So your endogenous opioid system. So
your own built-in opioid.
we have
I didn't know we
endogenous
had them.
opioid. That's how we developed opioids, because we knew how these chemicals work.
I didn't know that. All right.
So these are
built-in pain relief.
So basically, so if you're the fight or flight system,
Yeah.
So basically, if you smash your toe or something, but you're running away from a lion, those opioids that are produced are going to make you, so are going to decrease that pain, so you can just get away, right?
I'll give you a more specific. My wife was in a terrible car accident many, many years ago. She got T-boned at an intersection.
Yep.
Going through, somebody ran the red light, bam.
Yeah.
She called, she had a phone, she's crying, but she called police, she called me. I come running over, and everyone wants to know, how are you? She said, I'm fine. I'm fine. Wasn't until later.
Yep.
Till the adrenaline wore off.
Totally.
That the pain kicked in.
Yep. Very common. So studies using PET imaging show that sleep-deprived people have reduced opioid receptor activation, meaning your natural painkillers are not working as well.
Because of sleep deficiency.
Correct. So dopamine signaling also decreases with poor sleep.
What does that mean?
Well, dopamine is one of those kind of balancing hormones that makes you feel calm, and dopamine is also the addictive chemical.
Right.
People with using screens get addicted to social media or get addicted to alcohol or whatever.
Right.
So it's that feel good chemical. So animal studies show that sleep deprivation reduces dopamine D2 receptor activity in pain processing areas of the brain. And interestingly, administering a dopamine agonist, which increases your dopamine, can block the pain increasing effects of sleep deprivation. So basically, you can improve your pain by taking a dopamine agonist, if that makes sense. So you can if you increase your dopamine, you don't have as much pain. The orexin system, which I didn't know about this until I started doing some research on this. It promotes wakefulness.
Oh, okay.
Okay. So it also has analgesic properties. Sleep deficiency disrupts this system as well, removing another layer of natural pain protection.
I didn't know there were so many natural pain producers.
A lot, yeah.
Analgesic, like sort of
Right.
like an aspirin type of thing.
Yeah, I'm going through a bunch here, but there's way more than this.
Okay.
Yeah. So
dopamine, analgesic. What was the other one? The first one you said here?
there's orexin, and then the opioid system too.
Oh, opioids.
Yeah.
So we got opioids in our body, we got aspirin in our body, and we got dopamine, feel-good stuff in our body.
I don't know if we have aspirin in our body.
Yeah.
The rest of them we do.
Well, I would say the analgesic.
Yeah.
Sort of like an aspirin.
And then melatonin. That's the one that helps you sleep, right?
Right.
So it also has anti-inflammatory and analgesic properties. When sleep is disrupted, melatonin production decreases, removing these protective effects.
So you're not making it.
So you think like, well, melatonin can help me sleep, but also if you don't sleep, you don't make as much melatonin.
And maybe you don't need to go buy those melatonin pills like my wife takes.
I don't know. Well, those can be helpful. Yeah.
But we're always trying to force in what we're not generating.
Yeah, right. So, but it can help. I think I wouldn't bash that one yet, is what I'm saying.
Okay.
Yeah. On the flip side, sleep deficiency activates pain-promoting systems. So not only does it decrease the types of chemicals in your body that can help decrease pain, but it also increases the pain-promoting systems.
Yikes. So not only is it not suppress pain,
right.
It promotes pain.
Right, yeah, exactly. So adenosine and nitric oxide signaling increase with sleep loss, and both contribute to pain hypersensitivity. Most importantly, inflammatory markers like interleukin-6, TNF-alpha, and prostaglandins all increase with poor sleep.
Wow.
So those are all types of chemicals that rush in and cause more pain. They sensitize the nervous system in the area around an injury.
Bottom line,
yep.
Poor sleep turns down your pain protection and turns up the pain amplification.
Exactly.
Okay.
So
poor sleep.
So there is light at the end of the tunnel here.
I hope
There's some good news here. We have effective interventions, and research shows that improving sleep can improve pain outcomes.
Okay.
So how can you do this? One thing, besides medications or anything, is cognitive behavioral therapy for insomnia.
We had a guy want to come in here, and I sort of poo-pooed it. I'm sorry to say that. Cognitive behavior. Can you really, biofeedback, or what do you call it?
Well, you're talking.
You're talking to yourself.
Well,
feedback.
Yeah, but you're talking to somebody in this case.
Right.
So it's someone. It's kind of like getting some psychology.
Right.
But you're talking about the sleep hygiene and stuff like that. Things you can do, like including sleep restriction, stimulus control, addressing negative thoughts about your sleep, and relaxation techniques.
One, yeah.
So all those things, that education can help you sleep better, and then it's going to help to decrease your pain as well.
So you think that really works? That's a gold standard. That's a
yeah,
good
no,
one.
it definitely has research behind it. People do it, and I'm not saying it's a panacea. It's not the thing that's going to cure everybody, but it definitely has its place, and a lot of people get good results with it. So,
okay.
So in studies with patients with chronic pain and insomnia show that the CBT, cognitive behavioral therapy for insomnia specifically, not only improves sleep, but also it reduces pain severity. In osteoarthritis patients, it reduces nighttime awakenings, which predicted reductions in clinical pain. The key mechanism appears to be reducing inflammation. CBT has been shown to lower inflammatory markers like C-reactive protein and interleukin-6, which we talked about earlier, which we know sensitize pain neurons.
All right. Bottom line is, got to get better sleep, and there are ways to train your body cognitively to do better. But I can't do it, Doc. I need a pill.
Yeah.
I need a pharmacological approach.
Yeah, so there are some sleep medications. There's melatonin.
That's what my wife takes.
Yep,
Right?
yep. And that can be helpful for a lot of patients with, for instance, in some studies they saw it for temporomandibular joint dysfunction or jaw pain,
Yes.
fibromyalgia. It can help with that too.
Right.
Gabapentinoids like pregabalin.
Someday I hope
something
we
called
should
gabapentin. Yeah.
I wish we should do an episode on fibromyalgia because we've had so many people through the years, not a ton, particularly women say, I suffer from fibromyalgia.
For sure. Yeah.
And I've had doctors say, ain't no such thing.
Yeah. Yeah, I've got several patients that would be great for that, actually, and they could actually maybe come in and help elucidate what it's like to have it.
And nobody seems to know, is there a test for it? Is it really real, or is it just a description of a symptom?
It's more accepted now, I think, than it used to be, for sure. Yes, it's a real thing. But so back to the gabapentinoid. So we went through gabapentin. Remember, it can cause some cognitive issues, right? We went through that. So that's one that
go look that episode up.
Yeah, you just want to make sure you talk to your doctor about it, and make sure if you start having symptoms of forgetfulness, stuff like that, you want to tell your doctor and make sure you adjust things or try something different.
I'm going to stay away from that one. Okay,
fair enough. So, and then there's opioids, which we all know that can...
Is that an epidemic or what these days here?
Yeah, for sure. And so...
and that, you naturally, we take an opioids just to feel good, to feel better, relieve pain.
Yeah.
But does that disrupt
sleep?
Opioids,
it does, yeah. So opioids, and especially chronic opioid use, can actually kind of cause dysfunction with your sleep and in terms of the long term. And it can... cause it can contribute to short-term relief, but the detriment to your sleep and over time it's not worth it.
And I know so many people who have I don't suffer from this, but people who have nighttime awakenings just dart up in the middle of the night and then can't get back to sleep.
Yep, yeah, and this can cause that too, and so can alcohol consumption too.
Yeah.
Let's look into so what are we taking away from this basically? So if you have chronic pain, prioritizing sleep isn't optional. It's a fundamental part of pain management.
Isn't optional, folks. Here, right?
Yeah, I mean,
I can do without that.
Yeah, it's really one of the most important things you can do, and it's the cheapest thing you can do, and good for so many other areas of your body besides
good
just
for
the
what
painful
ails
areas.
You. Yeah.
Yes. So consider cognitive behavioral therapy, and talk to your healthcare provider to see what else in terms of medications or things like that might be helpful for you. And then there's surgical procedures. You want to prioritize good sleep the night before to prevent that initial increase in pain because you didn't get good sleep.
We should do a show on that too. How do you prepare for surgery?
Yeah, good one.
And people talk about not just get your body right, get your mind right. You gotta somebody's going to invade your body here, slice it open. You need everything you can to battle this.
Yeah. So,
and you may not get. The few times I've been in a hospital, I slept terrible.
Did you? Yeah. Oh, for sure. There's all those beeping machines, and they're getting you up to take your blood pressure or something, and
I thought that's counterintuitive. You're trying to get me to heal.
I know.
Get me home.
Yeah, I know. A lot of it's probably cover your butt kind of stuff.
I bet.
I mean, they do amazing work.
You said it, not me.
But I think a lot of that is probably, they need to make sure that they've shown that, we checked him and he was
and they have
alive.
to. It's a litigious society here. So
yes, I know. So the main thing here is that the sleep pain connection is real, right? And we know that we can do things to improve our sleep. And if you're one that has chronic pain and you haven't looked into trying to improve your sleep and you're kind of living with it, then maybe seek out someone that does cognitive behavioral therapy for it. At least talk to your doctor about it.
Right.
Try to get a handle on it.
And if worse comes to worse, I guess there are pills or other things you can do. But there seems like there's a wealth of other things you can do. I have one that just occurred to me. So you're a physical therapist. When you're treating an injury, you're trying to rehab somebody. Not only do you talk about sleep, are there things I can do to relax, to manipulate, to stretch, to something to do to my body here? Even exercise that make me go to sleep.
For sure. So I think exercise in general can also produce some endogenous chemicals in your body that help with not only pain but also in producing a sleepiness effect. But if you do it right, if you do exercise right before bed, that's usually not good because it kind of stimulates you.
Right.
But in general, people that exercise tend to sleep better as well. So that's not something a part of this study, but from my
own experience
and from people I've talked to, and I think there are some other studies that do support that. It's just not in this one specifically.
So lots of ways to help your sleep. Don't overlook it.
Yeah.
Okay. Well, if they need help beyond that, you're a physical therapist.
Yep.
You deal with pains and problems all the
Correct.
time here.
Yep.
And they're usually looking for a quick correction. I had a knee injury, I had a back injury, I had something happen, I fell, whatever, fix me.
Mm-hmm.
And you're saying maybe I can get you back up on your feet again, but same problem's going to reoccur if these pains aren't all going to evaporate if you ain't sleeping good.
It's true. Yeah. So you want to get a handle on that.
Okay. How do they get a handle on you if they want to find out and get more advice or more help or
I'm
just
at
discuss any of this?
Physical Therapy and Balance Centers. It's spelled FYZICAL.
Okay.
And that's in Lake Forest. If you want to call, it's 949-716-1800. If you want to find us online, it's www.physical.com /Lake-Forest.
And are you open to having consultations, or I guess you'd have to charge for it, but somebody would come in and say, I want to,
of course, yes.
I'm having a range of problems.
Yeah, if they want to do we do like a 20-minute consult.
Yeah.
If someone wanted to come in, that's free.
Okay.
If someone wanted to come in and do that, they can call the office and tell them, if they have whatever area of the body they want to have looked at, and we can do a consult like that, of course. Yes.
Because when I go see my doctor, he's only got 10 minutes, and he's there, all right, you came for this problem, let's focus on this, let's get a test, let's get a pill, let's cover up the symptom. I don't know that they're always addressing the root cause or even have the time. I would say
a lot of it's the time. Yeah, I know. Yeah, I think they care, but it's just it's hard with today's the way the medical industry is right now.
Get them in, get them out.
Yeah.
Because I know we want to keep costs down, and I get it, but I also want to get to the core issue, and it may be something as simple as sleep.
Yep.
Well, thank you. I'm going to go home and sleep better tonight.
Sounds good.
Well, there you have it, folks. One more reason to tune in. It can be some simple stuff, too. We're going to try and make health simple and give you a simple guide to a healthier life right here in Orange County's only community radio station, OC Talk Radio, streaming live from our simple studios here at University of California, Irvine's Beale Applied Innovation Center.